seconds, the perfect pregnancy can turn into an emergency.
Where do you feel that? Tell me where you feel it.
A baby could actually have heart failure, just like an adult.
Immediate action must be taken.
Here comes the second little guy.
Lives are at stake.
The risk to the babies is that they could die.
One wrong choice can mean the difference between life and death.
I also just don't want to get so sick that I die.
Every day, doctors make critical decisions for every special delivery. At 9 a.m., a sudden emergency erupts in the ER at Presbyterian St. Luke's Medical Center in Denver. 24-year-old Trinity Gorham is 30 weeks pregnant with twins.
Where are we finding babies? Baby A is head down, baby B is head up.
Trinity is having contractions,
Busy in there, huh?
and her stomach is unusually large.
Your belly been getting real big? Why? Did it just start, or it's been getting bigger and bigger real quick?
Trinity may have excess amniotic fluid, a rare condition that could throw her baby's heart into distress.
When did you start having problems?
Saturday, over the weekend, we detected contractions.
Trinity and her fiancé Dwayne were flown from Nebraska to Denver just hours ago.
She was just in for consultation yesterday afternoon, and they hooked her up to the non-stress test monitor, and they detected contractions, and they kept us in the hospital until 3.
Here, we're gonna scoot you down to the ultrasound room, and Dr. Barco's gonna take a look at the babies, and they may end up having to take some of the fluid off of one of them, the one with more fluid. We do that with the amniocentesis needle, little skinny needle. You won't feel much. Be okay.
They really haven't had a chance to say much right now. That's why we're going to get an ultrasound to see what they can do.
Here's baby A, and you can see that there's lots of fluid, abundant fluid around baby A.
The ultrasound quickly reveals the problem. The excess amniotic fluid is being caused by a disease of the placenta called twin-to-twin transfusion syndrome. Trinity's twins are not getting equal amounts of nutrition.
You've got one baby who seems to be blessed with most of the blood supply from the placenta, and therefore is growing big and has lots of fluid surrounding it. That's twin A, and then twin B, and that's the twin that's smaller, that is receiving just a very small share of the placental circulation and also has very little fluid around him.
Without enough blood, baby B can develop life-threatening anemia. The risk to baby A is even worse. Dr. Farco needs to drain as much of the excess fluid as possible.
One of the things that can happen is that baby A can increase its fluid load even more so and create a stress on its heart. And the baby could, in the worst possible situation, actually have heart failure, just like an adult. Well, hopefully, the short-term benefit here is going to be a decrease in her uterine activity. Want to cap it off?
But the procedure will provide only temporary relief.
Okay, well done, Trinity.
Dr. Farco expects the fluid to return, again putting the lives of the twins in jeopardy.
She said probably 2 more times that they'll have to take some amniotic fluid out before I have them.
Are you hungry?
Right now, what we need to do immediately is make sure that both of these babies are in no acute distress.
Do you know what a contraction looks like on the monitor?
Yep.
So what we're going to do is put her on the monitor and make sure both of the babies' heart rates are reactive and that they both appear to be healthy.
Tomorrow, the babies will undergo another evaluation. If the excess fluid returns, so too will the danger.
You feeling any more contractions?
Just now.
Just now?
Yeah, it's pretty swollen.
900 miles from Denver in Phoenix, Arizona,
Are you dizzy or nauseous at all? Okay.
Jessica Werner is having contractions. But she is only 26 weeks into her pregnancy, too early to deliver a healthy baby.
Contractions have seemed to come a little bit closer together, and she is feeling a lot of rectal pressure with them, which kind of means that the baby is moving down.
Jessica's pregnancy seemed completely normal until 3:30 this morning, when she awoke in a panic.
Because I was having cramping and I started bleeding.
She woke me up saying, "Hey, I have bleeding, we need to go."
2 hours later, Jessica and Steve were airlifted 30 miles to Good Samaritan Regional Medical Center, the top Phoenix hospital for high-risk pregnancies.
The baby was coming. They didn't think they were going to be able to stop it for much longer.
By the time Jessica arrived, she was already dilated to 6 centimeters, an indication of serious trouble.
With a full-term child, you do have to be 10 centimeters dilated. With a preemie baby, especially at this gestation at 26 weeks, the baby is able to fit through the cervix at 6 centimeters.
Jessica's baby is just 2 weeks past the critical point of viability. If it survives delivery, the infant is at serious risk.
26 weeks, you're still at risk for intraventricular hemorrhage, basically bleeding in the little baby's brain. Certainly infection. Babies that premature don't really have their own body's immune system fully built up.
Okay, here's the baby's head.
An ultrasound reveals that time is running out. There is little the doctors can do to stop Jessica from delivering.
She is vertex. She is vertex. She's a head is down.
There's a cervix, isn't it?
Right, coming down through here is the cervix. So the head is through the cervix, that's correct.
The baby's head, surrounded by amniotic fluid, has already begun to pass through the cervix, making a desperate situation even worse.
The longer she stays with her bag of waters in the vagina with the baby there, she increases her chance of getting an infection. So we always watch her very carefully, signs of infection, fevers, abdominal pain that's unrelenting.
Watch out.
Jessica is put on meds to slow her labor, along with a series of injections to stimulate the development of her baby's lungs. Insufficient lung tissue is its most life-threatening problem.
Any time that we can buy at this point to get those steroids on board is just a little bit extra that the baby will, the baby needs everything it's going to get for 26 weeks.
I need to take her temperature.
Of course you worry about whether or not she'll make it, but I mean, I'm having a pretty positive attitude, and the only thing I can really think of right now is the after effects. Preemies, of course, are more prone to illness.
If the delivery can be delayed for even a few hours, it could mean the difference between life and death.
From the last ultrasound you guys did see no fluid building up, right? Or
No, we didn't
like
see
that?
anything, huh?
Okay.
Looked good.
When I first found out, I was just crying, just basically crying.
20-year-old Monique Lopez is just hours away from giving birth to her second child.
I didn't know what it was. I didn't know if he was going to be okay.
And she's very frightened.
It's hard to tell the difference between lung and tumor.
18 weeks into Monique's pregnancy, a routine ultrasound revealed a mass in her baby's chest.
This is the tumor right there.
They told me something was wrong with his lung, but they didn't say exactly what was wrong with his lung until I went back again to do another ultrasound.
At that time, it was very small, measuring about 2 to 2.5 centimeters in size, and we felt that it was consistent with a cystic adenomatoid malformation of the lung, which is a benign tumor that occupies space in the lung. That's a little bit bigger. It's almost 8 centimeters.
When I found out, I was devastated. I just start panicking. So it was really hard for that bad news they gave me.
And all of this is tumor.
So is that bad that it's moving the heart that way, or?
If the heart is shifted too far over, then it affects how blood flows in and out of the heart.
The tumor is a rare collection of cysts and tissue. Though not cancerous, it can cause critical problems for the baby.
Some of these kids, especially when they have a large malformation that's causing the rest of the chest contents to be pushed out of the way, can be born with markedly underdeveloped lungs away from the malformation and can come out, have to be intubated immediately and be very hard to ventilate. This can be a lethal malformation.
But I don't see any fluid collecting in the baby himself. It's all outside in the bag of water.
Now 39 weeks pregnant, Monique's doctors at Good Samaritan Regional Medical Center believe her best choice is to deliver via C-section. The danger to her baby is too high to risk a vaginal delivery.
The tumor will have to come out. The question is whether it has to come out quickly or whether they can postpone the surgery.
Monique's baby may need surgery immediately after birth. As her delivery time rapidly approaches, Monique must prepare herself for the worst.
Just nervous. I just keep thinking, I just hope he's okay when he comes out.
"24 hours after arriving at the hospital in Phoenix, Jessica is winning the battle against time.
She's very emotionally drained and physically drained. She's not only scared, but she's tired and mentally worn out, and so she's getting the rest that she really deserves.
Although Jessica is still dilated to 6 centimeters, doctors have stalled her labor with drugs. Every additional hour the 26-week fetus remains in utero allows her lungs to mature, improving her chances of survival.
They didn't think I was going to make it to the second steroid shot, and I'm past the third now. So, and they seem to be very confident that the more, steroids we get into the child, that she has a better chance.
Your baby has the hiccups. Can you feel that rhythmic kicking?
Uh-huh.
That's the baby's hiccups.
Yeah.
That's good. That means that the steroids are kind of getting into the baby's system now to help the fetal lungs mature.
Suddenly, Dr. Lynn is called to Jessica's room.
It looks like there's a lot more blood than it really is. It's probably a lot more fluid that you're having than I think it's fluid mixing with blood. Basically, I was called to see her because she woke up out of sleep, sitting in a pool of bloody fluid. Our major concern at this point was that she ruptured her bag of water.
We're getting pretty close. Let him know what's going on and see if he just wants to go ahead and have you push.
An examination confirms that Jessica's membranes have ruptured, leaving her baby vulnerable to serious infection. Doctors have no choice but to let her go into labor.
We're stopping all medications that's going to stop her contractions. Our goal now is to kind of let nature do its thing.
Getting another one. Blow out the candles. Just waiting for that baby to come down more and more till she feels ready to push.
In just a few hours, Jessica's 26-week-old baby will be born. If her lungs haven't matured enough, it will take a medical miracle to preserve the miracle of the baby's life.
So you're 31 weeks tomorrow, huh?
Yes.
5 days after an emergency procedure at Presbyterian St. Luke's Medical Center to withdraw excess amniotic fluid, Trinity's twins are again having trouble.
They have decided they're going to have to draw some more fluid out because B's getting overfull too now.
A lot of membranes here. See them floating around in the
Yeah.
there?
Doctors discovered a hole in the membrane separating the two babies, possibly caused by the first reduction. Fluid is now building up around both babies, a condition that could cause their hearts to fail. By the time the reduction is over, another 2.5 liters of fluid have been drained from Trinity's womb.
It's just hard when you take off that much because it just kind of deflates everything.
But it's left her nauseated and cramping.
You walk really slow and you run down ahead of you and find out exactly where you're going, so you just walk slow.
You just sit.
As Trinity is moved to a room on the delivery ward, her pain suddenly gets worse.
I started feeling cramping when they were doing this second tapping. Ow. Oh.
Well, she didn't really have enough taken off last time. I think this is a real reduction amnio, and she's having some cramps, and that's par for the course.
Trinity's doctors are hoping her contractions will stop. Every day the babies stay in utero, the better their chances after delivery.
Show me where
right through here.
26-year-old Wendy Ross is in severe pain.
How about if I wiggle you a little bit?
Yeah, there's like pressure right here.
Right there. Okay. Well, we're
Just
gonna get
29 weeks pregnant with her first child.
She's going to go ahead and start an IV. Give her the 6-gram load.
Wendy was rushed to the emergency room 2 days ago with troubling symptoms.
It's been going on probably about a couple weeks, and I've had blurred vision, headaches, lots of swelling in my feet and hands and face.
Wendy's symptoms suggest severe preeclampsia, a pregnancy-induced condition that can lead to liver and kidney damage and seizures. Magnesium sulfate should reduce the chances of seizure.
It makes you feel kind of yucky.
Okay.
It makes you feel like your insides are on fire. You're sweaty. You can be nauseated.
If Wendy seizes, it could cause brain damage and reduce critical blood flow to her baby.
Her pain that she's getting in her headache is telling us that her liver is inflamed. The treatment for that is steroids, and if we can turn her around with the steroids, we can get some more time. If we can't, the only cure is delivery.
I'm just mainly scared, just because, you know, it's happening so fast, and I have all these questions, and like I told him I was having pain, and all of a sudden I'm hooked up to all these machines, so it just scared me.
I'm trying to stay strong for her, just so that I can help her in any way I can. I'm feeling the same emotionally that she is, probably. Scared, a little nervous. Just want everything to be safe for her and for the kid.
Just take a deep breath.
Okay, I'm sorry.
Well, I think she's getting sicker, and I think we're going to have to get her delivered.
Wendy's doctors have to make a critical decision. Deliver a 3-month premature baby, knowing it will have complications, or wait and risk Wendy's health.
We're just gonna leave that alone.
Okay.
But at this point, try to hold off if you can on your urge to push.
5 hours after her membranes ruptured, Jessica can't resist the urge to push.
Off the candles.
Like that.
Without the protective membrane, the risks to Jessica's premature fetus are mounting.
Got another one?
Baby's certainly at a lot of risk. It's, 14 weeks early, more than 3 months, and it's going to have a hard time regulating its temperature. Undoubtedly, it's going to need a tube to help it breathe. This little baby has a long hill ahead of it. She assures me she can push it out.
Yeah?
I mean, yeah, you have worries or fears, but I'm trying to focus on those right now. I just want to get her out. That's my #1 priority right now. I just want to get her out.
Deep breath in, and push, 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 push. 2, 3.
Jessica's labor progresses quickly.
6. Okay, one more push. Deep breath, come on. Give me big push here, big push. Keep going, keep going, keep going, keep going, keep going.
Pull back on your legs.
Pull back on your legs. Don't
Lots of pressure.
He does it. Let her go.
Lots of pressure.
Let her go. She's out. She's out.
Flip forward here.
Here we go. Can you see her?
Okay.
All right.
There we go. There she is right there. Okay.
Better?
Okay. Outstanding.
Savannah weighs less than 2 pounds. The doctors immediately begin to help this fragile infant breathe.
So far, so good.
She has her mom's feet long and skinny.
Yeah. This tube just goes down between the vocal cords into the trachea.
Savannah is taken immediately to the neonatal intensive care unit.
She wasn't supposed to be born. Her system, her immune system, her temperature system, her respiratory system, all this wasn't due to come online for about another 3 more months. So it's going to take a little bit of time, and that's why the neonatologists are going to be watching her very closely. Things can start out good. They can take a turn. That's why, the first couple of days is going to be very critical to see how she responds to everything.
Doctors in the NICU will attempt to stabilize the baby's pulmonary and cardiac systems. If unsuccessful, there will be little hope left.
I have good days and I have bad days.
Shara Kurtz is 34 weeks pregnant with triplets.
I have days when I just want to cry and feel sorry for myself.
The 33-year-old neonatal nurse wound up in the hospital when she developed symptoms that put her and her babies at risk.
She might have a case of preeclampsia or toxemia, which is high blood pressure associated with pregnancy.
Shara began experiencing preterm contractions at the start of her 8th month.
Some things just need a woman's touch. That's right.
Followed by signs of preeclampsia, a particularly dangerous condition in a triplet pregnancy.
It can get bad enough that mom can actually have a seizure, can have a stroke. Babies can die, fetuses can die. It can get pretty serious.
Adding to her distress, Shara was suddenly stricken with Bell's palsy, a condition that paralyzes the facial nerves.
It's coming back a little bit. When I first came in, it drooped all the way down. I couldn't close my eyes myself. And a lot of pain.
I thought she was having a stroke. I thought that's all I need with triplets is another complication. So of course we rushed down here and everybody said, you know, that you probably have Bell's palsy, but there's not much you can do about it.
Medications have brought down Shara's blood pressure and temporarily stopped her preterm contractions.
136/82, so it's okay. It's acceptable.
But there is no treatment for the palsy, a condition doctors cannot explain.
No one really knows what caused it. And I don't think, I've had a lot of doctors come and check me out, and I don't think anyone has any answers as to why.
Shara is still 4 weeks from her due date. Doctors are hoping now they can prevent her from delivering too early.
She had an amniocentesis yesterday, and that showed that the lungs are not mature yet, that these babies are not quite ready to be born electively.
If Shara's delivery cannot be delayed, her doctors will likely have 3 high-risk infants in need of urgent care.
I love you, Soupy.
Love you too.
Okay, let's see here.
1 week after Trinity started having early contractions, she's been readmitted to St. Luke's Medical Center. There are clear indications the twins are having trouble.
Was there any growth on B? It wasn't very good, was it?
It wasn't good at all.
In the past 12 days, doctors have drained excess fluid 3 times. Baby B is not growing normally.
So look at the difference in size here.
And the fluid is putting significant stress on their hearts.
I came back yesterday just for an appointment checkup, and they found out that they weren't getting the heartbeat raised as much as they would like.
Dr. Preco told me that you know where these children
Yes,
are.
I do.
Okay.
You gotta remember, these babies are old enough to be delivered if we needed to, and we'd like to go for it, make them as old as we possibly can, but not at the risk of letting one of them get sick.
But she's here for the duration now, so she's not going home till you have these kids, right? So
Trinity's 34th week is still 2 weeks away. Even if she can hang on until then, her babies will face serious risks after they're born.
Well, we'll be chasing these kids all day, all right? Okay.
For Monique Lopez, 9 months of waiting are about to end. She has no choice but to undergo a C-section. The tumor inside her baby's chest might not withstand the trauma of a normal delivery.
Okay, we're starting, Dr. Dupree. It's about an 8-centimeter left-sided cam lesion. The heart is pretty substantially shifted to the right chest. 1 cell there.
A lot of pressure when it comes to baby.
The delivery takes less than 5 minutes.
This is a very big baby.
Oh my!
It's a boy.
Wow! Wow! Right.
At 11:35 a.m., David Lopez, at 9 pounds 2 ounces, is born.
His heart rate's good. He's crying. He's breathing. So I think we'll just take him over to the nursery, do a bunch of tests, see what that looks like. Okay. And go from there. All right. Okay. Let's your mom. Go.
It's unclear if David's tumor has damaged his lungs.
We'll have the surgeons come look at him, and then we'll decide how much we need to do. Oh, look at him. Look at those eyelashes.
Oh, he's so cute.
Go say hello to your
Why don't you go with the
teacher.
baby? We'll take care of Mom, and you'll see her in about 30 minutes, okay?
One more kiss. Okay, one more kiss. All right. All right. Well, I'll talk to you later, okay? Congratulations.
While the initial signs are good,
Yeah, see if we can find it in our...
baby David will undergo a battery of tests to check the tumor.
Do ABG, CBC, and X-ray.
The next 24 hours are critical. Doctors must decide whether the tumor will require surgery
Right now, he's just biting too much.
and what that will mean to this tiny newborn.
It seems like there's been some sort of acute events this afternoon. Preeclampsia, it can be a nasty disease. Women can die.
12 hours after the onset of severe abdominal pain, Wendy Ross is still showing worrisome signs of high blood pressure, kidney problems, and an inflamed liver.
Nevertheless, I don't want to get you delivered too soon. Okay? You're...
I also just don't want to get so sick that I die. So.
Oh, yeah, well, that's not going to happen. Okay, I'm just...
Every minute of waiting puts Wendy at risk, but delivering a 3-month premature fetus is equally dangerous.
I mean, I'm really scared for him also, but it's my health that's getting worse, so that's what's scaring me.
I always struggle in these sorts of situations, you know. But I think that the safety of the mother is paramount, and although we want to preserve the baby, obviously, as well, too, but, we definitely want to make sure the mom doesn't get, morbidly ill. Her cervix is closed, and we got a ways to go. So nothing's going to happen tonight, at least vaginally. I think we should give the baby some benefit of the doubt, and mom as well, that labor is a possibility here, and try and move towards that.
But if Wendy's condition deteriorates, doctors will have no choice but to perform an emergency delivery.
But hopefully your pressure will stay that way too.
So that baby could be right here, and you actually know where they are.
Yeah, he's always down.
Really low.
For Shara Kurtz, it is the 6th day at Presbyterian St. Luke's.
It's in the 150s, that's normal.
For now, her most critical medical issues, high blood pressure and preterm contractions, are both under control.
Now this is the monitor for the contractions.
At this point, I think we're just waiting to see what happens. She is at risk for something to happen, and the best place for that to happen is the hospital.
The biggest concern is the health of her babies. An early delivery will mean all 3 are likely to end up in intensive care.
They would have a hard time learning to control body temperature, eating. It's hard for babies to learn to suck and swallow at that point, and they would have problems with their lungs.
Anxieties about her babies and the discomfort of carrying them are a heavy burden. For Shara, the minutes feel like hours.
As soon as I can show you.
8 days later, Trinity's twins have taken a serious turn for the worse. Baby B's blood volume is dropping dangerously low, and its heart is struggling.
Okay, right now, a little needle stick. This hurts. Push your bag back out. Push it out.
It started out kind of last night. Baby B's heart rate was up, and he was having XLs, and they wouldn't go back down real quickly, and finally he went back to normal. And then first thing this morning, he was high again.
Okay. Where'd you feel that? Where do you feel that? Tell me where you feel it.
Trinity has run out of time. She is being prepped for an emergency C-section. Her doctors believe postponing delivery any longer is too risky for the babies.
The risk to the babies is that they could die or be born unhealthy, deprived of oxygen.
Every second could be critical to one or both babies.
You guys put 13?
Here comes the second one.
There we go. That's a little DVD. Wow, look at that. Come on over here. Oh, look at this.
As the babies are delivered, the neonatal team steps in.
These are actually both babies' cords. This is the bigger baby, baby A, and then you can see the smaller cord in baby B. The babies actually tangle themselves up in their cords.
Yeah, pretty lucky to have everybody here and get a couple of more. Watch that stuff.
Baby A, Dakota Christopher, weighs 4 pounds 1 ounce. Baby B, Dylan James, is just 3 pounds 3 ounces.
There they are.
Can
I stay here with her?
You sure can.
Okay.
Dakota and Dylan are taken directly to the NICU. The next 24 hours are the most critical.
There you go, big guy.
This is the left ventricle. It's the main pumping chamber of the heart.
In the neonatal intensive care unit at Good Samaritan Regional Medical Center in Phoenix, 1-pound baby Savannah is undergoing a battery of tests. Her brain, heart, and lungs are being closely monitored for life-threatening complications.
If we get through the first 72 hours without any kind of a significant setback or morbidity, we have a more realistic chance of being able to get through this with a good outcome.
The head ultrasound, I talked to the radiologist after I looked at it. My preliminary findings was that it looked really good.
She's not out of the woods, so to speak, but everything's looking really encouraging. So that's what we kind of thrive on right now, is each encouraging news we get, it helps us a lot.
But every moment reveals something new, and Savannah is about to confront her first serious setback. In the neonatal intensive care unit at Good Samaritan Regional Medical Center, an echocardiogram has detected an abnormality in baby Savannah's heart.
The pumping chamber, it's called the aorta, okay? And when the baby's inside, this little blood vessel, the ductus arteriosus, is open. When babies are at full term, it closes better after they're born.
But Savannah's hasn't closed. If it stays open, it will disrupt blood flow, sending too little to her intestines and too much to her lungs and brain. Doctors will try to correct it with medication.
Hopefully the medication will work. We'll give her the 3 doses as long as her body tolerates it, and if it doesn't work, we can repeat it again.
If the treatment doesn't work, heart surgery will be the last hope. Later that night, Savannah develops another serious problem.
Parts of her lungs collapsed down a little bit, the little air sacs collapsed. When her lung is collapsed down, that can be a danger for her because she won't get as much oxygen as she needs without higher ventilator settings.
As her daughter struggles to survive, Jessica is being released. But leaving Savannah behind isn't easy.
I'm leaving today, so it's kind of hard.
She's definitely a fighter, and that's what I'm looking forward to, and that's what I know will happen.
Back at Presbyterian St. Luke's Medical Center in Denver, Shara has reached the critical 36-week mark in her pregnancy.
Well, my biggest fears were always that they'd be premature and that they'd be in NICU for months at a time. And we've talked to lots of triplet moms, and I don't think we ever met one that went as far as 36 weeks.
Shara's symptoms of preeclampsia are under control, so doctors have decided it's safe to deliver her triplets.
All day long I've been fidgeting and rubbing the skin off my hands, and I'm excited. I'm excited.
As is usually the case, Shara's triplets will be delivered by C-section.
It's hard to get triplets lined up just right for delivery in the proper positions. And oftentimes they'll be in variable positions or presentations which aren't favorable for vaginal birth.
Oh my goodness. What a, he's pissed. This will be A. He is squirming.
All right, here comes baby A.
He's squirming. This one's coming out breech.
B, here you go. All right.
you doing?
The 3 babies, 2 boys and a girl, are delivered without complication.
Mom, if you can walk with me down there, and that's the other 2. What's this little one?
I'm not sure. Is this A?
A.
This is probably Colquitt.
It will take a complete review in the NICU before doctors can give the triplets a clean bill of health.
We're just going to try to break your water.
Wendy Ross has been hospitalized in Denver for 4 days.
I don't feel good at all. I can tell my body's not functioning right.
Increasingly concerned about the dangers of Wendy's preeclampsia, doctors have decided they must induce labor, despite the risks to her 3-month premature fetus.
I'm a little scared about the inducing. I want to make sure his bone structure is strong enough, and I don't want anything to happen to him.
I'm just concerned about what's going to happen after the labor and after the delivery, and how long he's going to have to stay here.
Oh.
Not now.
To make her labor progress quickly, a nursing team will try to manually rupture the membranes around the baby.
Blow it away, hon. Atta girl. Atta girl. It's almost done. Almost done.
Sorry, Wendy, you're doing awesome. Almost got it. I almost got it, Wendy, but I couldn't quite get it, and it's causing me too much pain. It was all the way through, and I could feel the bag bulging. 60.
It's just a waiting game. I'm ready to get the show on the road.
Wendy is finally given Pitocin, a drug to induce labor. If it doesn't work, her doctors will have no choice but to operate.
I'm going to try to give him some oxygen, okay? If that doesn't work, we may have to put a breathing tube in because he's not oxygenating as well as I'd like to see. Okay.
In the neonatal intensive care unit, Monique's baby boy is being given oxygen to help him breathe. Doctors are preparing to examine the tumor on his lung.
I'm going to get an X-ray to see what the lung looks like, how much good lung he has, and I'm also going to do a blood test to see how well he's breathing on his own.
The X-ray will determine whether the tumor needs to be taken out immediately or if surgery can be postponed until David is stronger. But within minutes, the X-ray reveals a stunning surprise.
I don't see any evidence of that malformation or the tumor.
The results seem almost impossible to believe.
Things look really good. Okay. I don't see the tumor at all on the X-ray. It could be just that he still has the fluid inside his lungs from being inside, and when that fluid clears, the tumor may show up more. But at this point, his lungs and his heart look totally normal on X-ray.
That's good news. That's a big relief.
Doctors will get a second X-ray to confirm the findings. But right now, baby David's prognosis couldn't be better.
So he looks okay.
He's huge. He's so big.
It's a big relief. Big relief.
I want to hold him down. He's nervous. Oh, don't be nervous. He's just like your other baby, okay? He's fine. Yeah, my other baby's huger though.
For Monique, the only thing better than the good news is getting the chance to hold her son for the first time.
Oh, look how cute he is.
If it was just these 2 boys, it'd be easy.
Yeah, right.
24 hours after delivery, 2 of the Kurtz triplets are in excellent health. But baby Lillian is having some trouble.
She's had a little bit of mild respiratory distress, which just means that she's had a little bit of difficulty breathing. When we put oxygen on her, her oxygen saturations come up. So that means that she needs just a little bit of oxygen. Sometimes with C-sections, that's normal.
Shara is recovering from surgery, leaving Matt and his brother to manage the babies.
This is Colquitt, and this is Liam. I don't know if we had them named yesterday, but we came to a consensus yesterday. And then it looks like these guys will probably go home in the next couple days. It looks like Lillian might need to stay here for, a while, just until we can get her to feed a little bit better and get her to be off oxygen. One step at a time. I mean, Chera got a chance to do the feeding this morning, one of them, and between us, I think every 3 hours, we're basically gonna have a baby in our arms for about 2 hours and 59 minutes of those 3 hours.
With the delivery over and Shara's Bell's palsy remaining unchanged, the Kurtzes will soon turn their attention to the challenges of parenthood.
Yes, you boys look different. Thoughts here.
After several failed attempts, Wendy Ross's water finally broke. But her cervix still isn't dilating and she's not going into labor, forcing the doctors to make a decision.
You know, the water bag's been broken and we could expose the baby to infection at this point.
Okay.
And second of all, we're inducing you for a bad case of preeclampsia,
Right.
which could get worse as we wait, the longer we wait. So I think it's time to deliver this baby by C-section.
I'm relieved, but I'm also very scared, for complications.
The delivery will resolve Wendy's problems, but it will begin a potentially difficult journey for her 30-week-old baby.
Here we go. Section, please. Come right on. Here we go.
At 12 noon, 2-pound Dylan Matthew Ross is born. It is immediately apparent that he needs help breathing. This premature, any problem with a vital system is life-threatening.
This is it.
Arm's gonna be pretty weak, so I just want to help.
But it will be several more hours before doctors know the full extent of little Dylan's problems.
Look at, she's peeking open one eye. Hey, there's a milestone.
48 hours after delivery, tiny Savannah is in a complicated struggle for life. Doctors are battling a problem in her heart valve, as well as a partially collapsed lung. Right now, her parents are anxiously awaiting the results of the latest X-ray.
So here is the part of her lung that was most affected. It's more white, more dense. Those little air sacs have closed down. Now this morning, see how it's darker? Yeah. Big difference, huh?
That's a huge difference.
Yeah.
In less than 24 hours, the condition of Savannah's lungs has improved significantly, reducing the stress on her respiratory system and her heart.
We don't want to overexpand her lungs, and yet we don't want to underexpand them and cause a collapse.
It's been an emotional roller coaster because I don't think I'm still accepting it as a reality yet.
I have really good news. Things look really good, and he's breathing on his own, and he's doing well.
24 hours after an anxious delivery, baby David's second day of life is going well. Repeated X-rays indicate that the chest tumor is no longer threatening his life.
But I don't see anything.
Why it's a whole lot smaller than we were originally told, I don't know. The lungs may have expanded and left this thing looking smaller than it seemed to be on ultrasound. This kid looks like he's doing fine.
Do you know if he's going to be able to come home with me?
I think he will.
Oh, okay.
I think he will.
Put this on him.
That's the best news I had all day today. My biggest fear was like, I'm not going to be able to take him home. They're going to do surgery on him right away. What if something happens to him? What if he doesn't make it?
Monique and David had prepared for the worst, but instead were given an unexpected gift: a new son in good health. Despite arriving 2 months ahead of schedule, And weighing only 2 pounds, Wendy's new son, Dylan, is doing surprisingly well.
He does not need endotracheal intubation. He does not currently need medication to help open his lungs. Currently, he's needing only a little bit of extra support of oxygen and pressure on the nose and airway to keep the lung open.
Is he sleeping? I've only been able to just touch him, so I haven't really had to hold him in my arms, so I'm really excited about that. He's got long fingers. Hi there, sweetie. I can't even explain it. It feels so good. Finally get to hold him. So tiny.
For the next few days, Dylan will be carefully monitored. But right now, his doctors are confident he'll continue to thrive.
It's just been a miracle that he's been so strong. I mean, for as small as he is and what he's had to go through, I think he's awesome, and it's just been a miracle.
Four hours after her emergency C-section, Trinity and her fiancé, Dwayne, are visiting Dakota in the neonatal intensive care unit for the first time.
They said it was a very lucky ordeal that they decided to do C-section instead of normal delivery. Baby B would have been in some real trouble. They say maybe he would have not have even made it.
Despite the difficult birth, Dylan, baby B, is doing remarkably well.
They're responding just the way they had hoped that they would. Happy that everyone is healthy and this part of the ordeal is over.
You ready to go back in, sweetheart?
Probably a little bit anxious too as to what kind of care these babies are going to need from this point on, but we'll take that as it comes.
Now in her third day of life, baby Savannah is nearing the critical 72-hour mark.
So here's the LPA, and that's it, but it stops and never goes into the PA.
Her prognosis is improving almost hourly. Her lungs continue to get stronger, and the results of a second echocardiogram are promising.
Mario did come back today and did her echo, and we are looking to see if that duct had closed, and it is indeed closed, so that's really good news.
Happy now? Yes. I just felt it was a major hurdle to overcome to get her more stable. I felt with the valve being open, it would kind of, that process would kind of get hindered, so now I feel much better about what we're going to do.
After 3 anxious days, the Werner family is beginning to feel hopeful. Many challenges still remain. But each of these 8 babies have already surmounted enormous odds after undergoing special delivery.